Hi, I'm Dr. David Smith. We're here at Baylor Animal Hospital, and we're answering some of our Facebook questions today. And most common question asked was, what about this itching, these allergies right now? Well, a big culprit's right here on the table, and that's pollen. And you can see this stuff here. This is all full of pollen. This came off an oak tree, and there's an oak tree branch. As these buds come out, more pollen is released, and so oak is one of our primary allergens. Now, what happens when this stuff here hits that dog's skin down there, you can see how itchy he is. Candy's just kind of scratching around his back, and this dog's going into hyperspace with itching. And I can imagine that you folks at home also realize that when your dog is itching like this at night, in the middle of the night, you're standing there going, what should I do? The dog's waking me up. So the problem is allergy, and now we have the itchies, and so we have to do something about it. And there's a number of ways to handle them. There are drugs, of course, that can be given to stop the itching. Notably, antihistamines can be used. Unfortunately, they don't work as well. And we also have other drugs, even cortisone, which can be used. But they all have to be used in conjunction with your veterinarian to make sure that they're used properly and they're not overused, because they are powerful drugs. There's also things that people do. You might have heard of an allergy doctor, and the person has to go to the allergy doctor to get allergy injections. Well, we have the same thing for dogs. We can test them. We can find out whether they're allergic to this oak pollen, or if they're allergic to any other pollens or any other things in the environment, including fleas. And then we can make vaccine from that information, which then we inject back into the dog, and that's called hyposensitization. That is a very good way of controlling itching, but unfortunately it doesn't work on every dog, and it's expensive, and so that's another thing that you might have to think about before you go into treating your dog. I will say that in our clinic, most people will treat the dog for itching, hoping that it is what we call a seasonal allergen, meaning after a couple of months, maybe 6 weeks, dog will stop itching and maybe they'll be comfortable for the next 5 or 6 months, and then maybe in the fall we start again. That's what we hope for. Some dogs, unfortunately, in our environment are itchy not only to this pollen, but some other pollen that's coming out even in the spring, fall, winter, summer. They itch all the time, and those are the ones we normally recommend doing hyposensitization. So that's our itchy dog and itchy cat problem. Cats have the same problem, and we can treat them in exactly the same way. So if there's any questions, please give us a call. We are definitely involved in any of these dermatologic problems because we see them every day. We'll probably see 10 itchy dogs today, and we see them every day, so we have a good idea what to do. If you have any questions, definitely give us a call. We've had other suggestions for these videos, and we will be answering those questions as we go through our tip of the week. So this is Dr. David Smith from Baylor Animal Hospital, and this was your veterinary tip of the week.